I do want to say I've heard that the Labour Party are about to attack with some more smears, particularly around the issue of drugs. And I want to be very serious about this. In the last 13 years, drug deaths have increased every single year. It's an incredibly important and serious issue. For the Labour government to be playing political games with people's lives is totally unacceptable. And what I think it speaks to in places like Manchester are why people are sick of the old establishment politics. They're seeing people who aren't taking issues seriously, who aren't doing the things that need to be done to protect people, to take a public health approach, to make sure that children absolutely can't go anywhere near drugs. Right now, children can often get drugs if they want. That's a completely unacceptable situation. And that's why I'm saying very clearly, I want to legalise, regulate and control drugs. And that's a public health approach by public health professionals.
You were talking about that in terms of your drugs policy. There will be people who do have concerns that if we legalise all drugs, it is going to be easier for young people or anyone to access them, obviously. What do you think about those concerns? It's not a smear to raise concerns about it.
It's not a smear at all if it's done in a sensible way to have a conversation about drug policy in this country. And that's absolutely what we need to do. And by the way, there's people like the Labour Mayor in London, Sadiq Khan, who's saying that we need to work with the Drugs Commission to look at a better policy for drugs. So let's have that conversation, rather than the conversation the Prime Minister and the government seem to be having, which seems to be shouting lies about the Green Party. Take alcohol, for instance. We regulate it because we know it's dangerous if anyone can get it any time. And so it should be the same with drugs. Taking a public health approach is not about saying it should be fully accessible to everyone. It's recognising that the war on drugs is failing. That's not a contentious thing to say. All around the world, when people have tried to have the same policy we've had with drugs, it hasn't worked, and it's not worked in this country. So what I'm talking about, and this has been tried various ways around the world, including places like Portugal, where it's reduced drug deaths, reduced HIV transmissions, and reduced what's often labelled as antisocial behaviour. Rather than allowing drugs to be in the hands of drug gangs or to be on the black market or in the streets, what you're actually saying is if someone has a problematic relationship with drugs, then they should go to a public health expert or someone in the National Health Service to get the expert help and advice that they can need. That seems, I think, to most people a more holistic, sensible way of having an evidence-based approach to drugs, rather than using it as a line that you just shout in an election campaign. Meanwhile, more and more people are dying and more people need help, including in places like Gorton and Denton. Hannah's said that she's spoken to people on doorsteps who have experiences of drug harm or drug death. There's a group called Anyone's Child who is made up of people who have lost children, grandchildren, brothers and sisters to the war on drugs and are saying it absolutely isn't working. We need a public health approach, and that public health approach looks like legalising, but the important bit is control and regulate. You never hear Keir Starmer or the government talk about controlling and regulating when talking about the Green Party policy, and that's fundamentally dishonest. So let's be honest what we have. We have the Prime Minister of this country talking about a really serious issue and talking about it in dishonest terms. That's vile, that's disgusting, and that's the exact kind of politics people hate in this country. I'm saying let's have a sensible, evidence-based approach led by health professionals, led by drug experts, and let's not make this a cheap, stupid game where people continue to die.